This is Dr. Pat Sharp with Neuroeducation in Spokane, Washington. And today I'm going to talk briefly about a kind of a very sad situation that there's so much depression in children in this day and age. 40 years ago, when I started in private practice, I hardly ever saw children that were depressed, and now it's fairly common. It's even common, sadly to say, in toddlers. A lot of people think that's just not possible. But sad to say, it is possible. And even the Association of School Psychologists is now recognizing that it is a growing concern with the little ones in our communities. It is considered a serious mental health condition, and kind of the things that you'll see more often than not in little ones isn't necessarily the thing you associate with depression that you see in adults. But you will see this kind of general malaise, this lacking in energy and enthusiasm, which is not like children. They'll tend to be more withdrawn, have a lot of trouble attending to anything, even things that should be fun. And they're just generally not enjoying life. It's just everything is too hard, too much of a struggle. And then if they're already in school, you might also, well, first of all, they won't be doing well in school. They won't be participating. They can tend to be irritable and hypersensitive. I mean, just prone to tears at the drop of a hat for something that shouldn't really cause that kind of reaction. They may even be saying things like, I'm stupid or I'm ugly. They won't have any friends, or say they don't have any friends. They'll feel unloved and unlovable. They have this sense of worthlessness and hopelessness about them. And one of the reasons I wanted to talk to you about this today is that it's not hopeless, and there's much that can be done. And more often than not, it is successful. It does help a child cope and get out of depression. Now, this is a very sad fact, but it's a very true fact. It's rare, but suicide attempts do occur. They don't occur like the adult one, where they, shoot themselves or hang themselves or take poison of some kind or other, swallow a bunch of pills. More often than not, it's just this kind of very reckless, dangerous behavior. And their intent, of course, is to hurt themselves, because they don't really, at a very young age, have a very good understanding of what death is anyway. So the causes, they can either be genetic, however, and we do know that there is a gene connected to the display of depression that shows up, and it can show up even in very young children. Not very commonly, because it doesn't typically show up until about teenage land. But all of these genetic predispositions don't necessarily automatically mean you're going to get a depressed child. So if you suffered from depression, just be on the alert, but don't expect that every one of your children is also going to have depression. More likely than not, especially in young children, depression is caused primarily by either one of two things. One is a dysfunctional family where there isn't any real care, that whole underlying piece that allows a child to feel loved and lovable and capable, and they want to please. Their brains are wired to please. So when they're not able to please, then that causes problems. And typically that's happening in a dysfunctional family of one kind or another. The other thing that can be environmentally causing depression in a child is bullying, consistent bullying, and or some kind of trauma. And oftentimes little ones won't be telling you about a trauma, like something that happened to them. It took me months sometimes to find out from a very small child by literally, working with them, sitting under my table, because that's where they felt safe, to tell me. And he didn't tell me in words, he told me in pictures about a trauma that had happened to him. Something he kept drawing the same sort of theme in a picture. Now, most people agree that generally in the environment, one is that there's just too much stress, and that triggers all kinds of mood disorders as well as depression. And we just have a lot of stress in our day and age. It's on the television, it's in the news, it's in our talk with each other when we don't think our young children are listening. So guard what you say. They don't need to know everything that you know. Um, and then just our current lifestyles don't allow for the kind of support. Mom's off at work. I'm not saying moms have to stay home from work, but when that kind of consistent caring isn't there, it can have an effect. So make sure you check out, the daycare centers that you're taking your children to. Don't just assume that it's a good, supportive, loving environment. Um, kids are getting less exercise. We know exercise induces, feel good hormones in the brain. They don't have as much casual time or recreational time that's not structured. I mean, everything is, the soccer games and the classes for piano and the whatever they're doing. Their calendars are just filled with too much activity. So there's not as much technology free play time, and there's less sunshine and a whole lot more computer time. And also then poor diet can play a part in that. So all of these things really set the stage for depression. Now, in order to help your child, you've got to take it seriously. Don't just keep saying day after day, I don't know what's wrong with him. I hope he snaps out of it. It can be a disease, so don't blame yourself for that or your child for that, but get help. Don't panic, because 80% of kids with depression who are treated and have supportive parents, you wouldn't be listening to this if you weren't a supportive parent, that helps them to recover. So learn everything you can about depression in children. That's going to be number one, helpful. And let your child know that it's okay to be depressed. Try not to say you're a bad child because you're not feeling good, because you're sad. Give them the impression that we're on a team and I'm going to help you get better, and I'm going to do whatever it takes, and we're going to find help until we get better. Talk to them frequently, even though they won't want to talk to you. So make it really low stress. Don't fire them a bunch of questions. Kind of more open-ended things work better. Like, tell me about when you were at recess today, or tell me about when you stayed after school that day. Those kinds of things are better than kind of direct drilling. And be your child's advocate. You need to be, because he's not able to be, or she's not able to be, in the healthcare system and at school. And don't be afraid to ask a child, even a fairly young child, are you thinking of hurting yourself? Especially if they've done something kind of reckless and dangerous, and that's kind of not been their nature when they were much younger. Encourage socialization. Get them into some very small groups, like 3 or 4 kids in a group, or one-on-one with a child. And encourage talk therapy. In other words, see if you can get in to see a counselor who does cognitive behavioral therapy, or CBT. This can really help your child break out of all these negative and self-hating kinds of thought patterns that get generated by depression. And above all, be patient. This won't go away in a day or a week. But the good news is treatment absolutely works. There is hope. Your kid can get better, but it's going to need treatment. And there's many, many good books out there, but here's 2 books I really highly recommend to parents. One's by Tamar Chomsky, and it's Freeing Your Child from Negative Thinking. And the other one is by Deborah Serrani, and that's Depression in Your Child. And so get knowledge, get counseling, and possibly look at medications, or be willing to look at medications that could help.